Hello, everyone. This is Hannah McGahey. I am the Workforce Coordinator for the Kansas Children's Cabinet and Trust Fund. I'm very excited to have you here today for the biweekly webinar. Today is August 24th. I am joined by Megan Broha, my colleague. She will be monitoring the chat and answering any questions that I might not see. We did have a little change in our agenda from what was sent out. So today's agenda is going to include some system updates, including upcoming conferences and webinars, as well as some professional development opportunities through many of our partners. And then we're going to have a presentation from KDHE about monkeypox, just kind of a general overview as we might start to interface with that in our daily lives. So Greenbush, for those of you who utilize Greenbush for professional development, they are hosting a series of virtual forums beginning in August, and we'll be going through April. And so this is just the format is a forum for early childhood professionals to really collaborate, learn, and grow together. And the cost for non-members is going to be $50, but if you're part of that specialized learning service or SLS, the consortium, it is free, it's included. So we encourage you to check that out if you're interested. And again, we would like to notify you all that the application period for centers is closing later this week for the Child Care Workforce Appreciation bonuses. And then the application period for preschools is going to be opening soon. So if you are preschool staff and you qualify for that, and you've been notified that you qualify for that workforce appreciation bonus, stay tuned. And if you're just hearing of this for the first time and you want to learn more about the bonuses, you can go to the Child Care Aware of Kansas website. There's FAQ sheets, there's a couple of full webinars that are recorded, and it will be able to tell you pretty much everything you need to know about deadlines, eligibility, and then the actual process of getting approved and getting that one-time payment. Also, if you or somebody you know has not benefited from the child tax credit for tax year 2021, there's still time to do that. This is a partnership between multiple agencies, the Partnership for America's Children, the Coalition on Human Needs, Kansas Action for Children, and then the United Methodist Health Ministry Fund. And there's a webinar that's hosted by Code for America. I would encourage you, if you feel like you need to do this or need to learn more about how to get that child tax credit, to at least register for the webinar, because even if you don't attend, they will send slides and the full recording after it's done. So there's still time if you haven't got that 2021 child tax credit. We have a ton of conferences coming up. It's very exciting. Some of them even in person. So KSAEYC is hosting their annual conference in Manhattan this year. It's going to be October 7th and 8th. I'm sorry, 7th through 8th. We do not have registration information yet, but I will absolutely share that as soon as we get it. I would venture to guess that that information will also be on the All In for Kansas Kids weekly emails. So stay tuned for that. The Kansas Breastfeeding Coalition annual conference and meeting is going to be held in Wichita this year. It's October 13th through 14th. If you would like to register, you have questions, there's going to be, I believe, an email put into the link, right, put into the chat. And then we have the Parent Leadership Conference November 4th and 5th, and that's going to be in Topeka. It's going to be at one of the downtown hotels. And we heard about this at our Early Childhood Recommendations panel meeting last week. Really, really cool opportunity. Great resource for parents, for families. And I was not aware, but there are actually activities specific for teenagers and children at this event. There's scholarships for families to stay at the hotel if you meet certain travel requirements. So we will be pushing out those registration links and all of the details when we get them, but just kind of put it on your calendar and keep it on your radar if there's a family that you know that might benefit from one of those scholarships or would need to travel. so we can make sure that we connect them with the appropriate people. Also, there should be an email in the chat for Pam Noble with KCSL if you have any questions about the leadership conference itself. Oh, and so it was so nice that I went ahead and put it on there twice. We also have our home visiting conference. And I would like to highlight that the last day to register and get your full, packet of swag, all of your materials is August 26th. So if you've not registered for the free, totally virtual home visiting conference, which is September 7th and then the 8th, please do so. Really, really cool lineup that they've put together, and a lot of hard work has gone into this across the various home visiting domains in Kansas. And again, registration closes for that August 26th, so we are coming up on time for that. A couple of professional development offerings if you're needing to get some of those KDHE approved clock hours. You can always find ASQ3 and ASQ SE2 trainings at the TASM website, which Megan's going to drop that in the chat. But they do have those dates listed through August for both the ASQ3 and the ASQ SE2. We also always have wonderful offerings from KCSL about child abuse prevention. I just listed a few of them, but of course we have ACEs and resilience, and then adverse childhood experiences and child abuse and neglect. So if you are needing some hours or needing to freshen up on any of these topics, the TASM website and the KCSL training calendar are always fantastic resources just to find quick and easy learning opportunities. And if you miss these, like specifically ASQ3, ASQ SE2, if you miss these dates in August, they do roll around, and so we'll have new dates to share with you for both of those topics. A couple of other neat webinar opportunities. A webinar was put together by Childcare Aware of America surrounding just some good business practice for specifically recruitment and retention of childcare staff. And so I would definitely check that out, especially as we know that there are so many workforce shortages and everyone is, kind of shopping from the same pool of candidates. And another very important, very pivotal piece of information that could really affect some families. So with the declaration of public emergency ending for Medicaid and CHIP continuous enrollment, that's gonna create some issues for some families. So if you or somebody you know could be affected by this, by the emergency declaration that was made during the pandemic surrounding Medicaid and CHIP enrollment, that will be changing. So try and find one of these dates here that are listed to listen to that webinar, and it'll give some guidance about how to avoid a lapse in coverage as we transition out of that emergency state. At this point, I'm going to go ahead and introduce Dr. Farah Ahmed with Kansas Department of Health and Environment. She has graciously agreed to give us an overview of monkeypox, and so we're very excited to have her here with us today.
Hello, everyone. Hannah, can you hear me okay? Okay, great. So like Hannah mentioned, I'll just kind of go over a little bit of background information about monkeypox. Hopefully it's not too much background information, and then go over some guidance updates specifically aimed at what schools and early childcare programs can do to prepare themselves. Go ahead and go to the next slide for me. Thank you. So, what is monkeypox disease? It's a rare disease. It's caused by an infection with the monkeypox virus. The monkeypox virus is part of the same family of viruses as the variola virus. So that's the virus that causes smallpox. While the monkeypox symptoms, they are similar to smallpox symptoms, but much milder, and monkeypox is very rarely fatal. And it's not related to chickenpox. And monkeypox was discovered in 1958 when there were 2 outbreaks of a pox-like disease that occurred in colonies of research monkeys. But despite being called monkeypox, the source of the disease is actually not known. But it's suspected that African rodents and non-human primates like monkeys might harbor the virus and be able to infect people. Next slide. So at this time, we think that people who do not actually have monkeypox symptoms cannot spread the virus to others. So, kind of putting it into context. So because everybody's familiar with COVID, probably overly familiar with COVID, with COVID, we learned early on that you could actually spread it before you had symptoms, or even people that never had symptoms could be able to spread, right? So at this time, like I said, the understanding is that people actually have to have symptoms of monkeypox to be able to spread it to others. The monkeypox virus spreads mostly, in this current outbreak, is spreading mostly through kind of intimate skin-to-skin contact with someone who has monkeypox. But, cases have been identified among household contacts, and so that is important to remember. So anyone who has kind of that close personal contact with someone who has symptoms of monkeypox can get the disease. Monkeypox can spread from the time that symptoms start until that rash has fully healed and there's a fresh layer of skin that has formed. So the illness typically lasts about 2 to 4 weeks. And the virus is kind of, spread person to person through direct contact with that infectious rash, or touching the scabs, or touching the fluids coming from the scabs, that kind of thing. The virus can also be spread through respiratory secretions. So again, that's more like very close kind of face-to-face contact. It can be spread by touching inanimate objects like clothing and linens that previously touch the infectious rash or body fluids from the person who is infected. Additionally, pregnant people can spread the virus to their fetus through the placenta. And then you are also able to get monkeypox from infected animals. So, being bitten or scratched by an animal that has monkeypox, or eating meat that's from an infected animal. Next slide. So, what is the amount of time that it takes to actually develop the disease after somebody's exposed? Monkeypox actually has a very long incubation period. So it can take anywhere from 3 days up to 17 days. Really, the outskirts would be like 21 days, but about 3 to 17 days from when someone is actually exposed to the virus to actually developing symptoms. And most people are going to typically develop symptoms around, between like 5 and 13 days from when they were exposed. Again, we don't think that people who don't have symptoms are spreading the disease. And so what that means is people exposed to the virus that don't have symptoms are not then spreading it without knowing it. Next slide. So the symptoms of monkeypox, we've got what are called like prodrome type symptoms. So fever and headache, muscle aches and backache, swollen lymph nodes, chills, exhaustion, respiratory symptoms like sore throat, congestion, drippy noses, cough, that kind of thing. So very, nondescript symptoms that could be part of a lot of illnesses. And then there's the rash, and that rash can look like kind of pimples or blisters. It can appear on the face, inside the mouth, other parts of the body. And that rash is going to go through different stages before it finally heals. And again, like I said before, the illness typically lasts about 2 to 4 weeks. Next slide. So just as a reminder, When we talk about isolation, that's really that public health tool that is separating ill people, so people who have the disease, from people who are not ill. So if a healthcare provider suspects that someone has monkeypox and is testing you, then you should actually remain in home isolation. Don't touch a rash, limit your contact with other people and animals while you're waiting for the test results. So that's kind of the first piece of the home isolation. And then if your test result comes back positive, then cases are supposed to remain in home isolation for the entire time that they're considered infectious. And so that person is considered infectious from when their symptoms first appear to when their rash or their lesions have crusted over, the crusts have fallen off, and now you've got a fresh layer of healthy skin. So that home isolation period can last from about 2 to 4 weeks. So again, this is people who have, tested positive, they have monkeypox. So CDC does recommend that people with monkeypox remain isolated at home or some other location for the duration of their illness. But of course, that might not be possible in all situations. So for example, needing to seek health care, and there's guidance on how you can mask for respiratory symptoms. You can cover those rashes, those lesions with clothes and bandages, etc., if you do need to leave home isolation. You don't need a test to end home isolation, and that home isolation just kind of ends when that rash has resolved. Next slide, thank you. So what's the guidance for quarantine? So just as a reminder, quarantine is that public health tool that separates people who have been exposed to a disease from people who have not been exposed. So they've been exposed, but they don't actually have the disease. And so for monkeypox at this time, there's no quarantine recommended for people who've been exposed but don't have symptoms. Again, that's because we don't believe that a person is infectious to other people until they actually show symptoms. If a person who has been exposed starts to show symptoms, then they would need to seek a healthcare provider and then go through the process of being tested. Next slide. So what treatments are available? So you might have heard a lot of information, so I'll try to distill it down. So monkeypox in general, it's a pretty mild and self-limiting disease. Most individuals are going to recover on their own in the 2 to 4 weeks without the need for medical treatment. But there are some people, so people with weakened immune systems, people younger than 8 years old, or individuals with genital or rectal rashes that might need treatment. And I did highlight here those younger than 8 years old because at least in previous outbreaks of monkeypox, that age group can have slightly more severe symptoms. So there is an antiviral medication. So antiviral medication would be used on people who are infected. It's called tecovirimat or TPOXX. It's available in very, very limited quantities. So KDHE actually has a very limited supply of the oral tablets. And so what the process right now is, if KDHE is notified about a positive lab result, our state health officer, who's a physician, would reach out to the ordering provider. So the provider that ordered that test that now is positive, and is going to discuss whether TPOXX is indicated for that patient. And then there'll be a discussion with the patient. And then if it's indicated and it's needed, then KDHE would deploy the doses that are held here. Next slide. Another natural question is there a vaccine available, for people who are exposed to or who might be exposed to monkeypox? And so there is a vaccine available. It's the preferred one is the Jynneos vaccine. It's currently available again in limited quantities through KDHE as post-exposure prophylaxis. We've also pre-positioned doses kind of across the state. So what post-exposure prophylaxis essentially means is, if someone is a known contact that's been identified by public health, through our case investigation or our contact tracing. So essentially what that means is, right, somebody tests positive, then at KDHE, we're doing that case investigation and we're talking to them and we're identifying those close contacts. And so those close contacts, we would talk to them, their physician, about whether vaccine would be recommended. So there's quite a lot more information about who JYNNEOS would be recommended for. So I've kind of included the link here. Next slide. So just kind of the state of the outbreak right now, as of August 22nd, when I made these slides, there were about 15,433 cases in the US so far. So that's a cumulative number. That's not the number who are considered currently infectious. Kansas has identified 3 cases so far. New York, California, Florida, Texas, and Georgia all have identified more than 1,000 cases each. Next slide. So on August 19th, CDC did release a monkeypox guidance for schools, early care and education programs, and other settings serving children or adolescents. So I've included the link at the bottom of this slide. So please note, so this is less of a guidance document and more like an FAQ document. And then on August 22nd, CDC held a webinar about that guidance. So the next few slides are taken really right out of CDC's presentation. So to frame the discussion, it's really important to keep in mind that the risk of monkeypox in the US is still pretty low to the general public. And in Kansas, it's very low. The FAQ document kind of lays out some operational strategies, but really schools and childcare programs don't need major changes to the way that they operate. Next slide. Like I said, there's nothing really extra or special you need to do as a school or early care program to prepare for a potential case. So these settings should prepare like they would for any infectious disease. So that includes messaging to attendees and parents and guardians about, staying home when sick and practicing good hand hygiene using soap and water or an alcohol-based hand sanitizer. These settings would continue to regularly clean and disinfect their facilities. And then, they would have ahead of time kind of a space identified where ill children or adults, again, any illness, right? It's not monkeypox specifically, but someone starts feeling sick during the day, where can they go to be away from others before they leave the facility? And then making sure healthcare staff have personal protective equipment on hand when, that includes masks and gloves and eye protection. Next slide. So the key thing to remember here, again, is monkeypox risk is really low in the US and even lower in Kansas. So, there are so many more rash illnesses that are very common in kids. So we want to avoid any kind of blaming or excluding of children based on fear. It's just, it's just that normal managing of children who are sick, right? If they've got a fever and they've got a rash, they should stay at home. Parents should be encouraged to talk to their child's doctor. And again, considering the number of rash-like illnesses. So like right now, we're getting tons of schools back in session. We're getting tons of reports of hand, foot, and mouth, right? It's just that time of year. For adults, they can be encouraged to really understand the symptoms of monkeypox that we discussed earlier. So if they've got kind of a new or unexplained rash, please talk to your provider. If that provider is going to suspect monkeypox, then they would notify KDHE and test. Next slide. So if someone actually tests positive, KDHE is going to be conducting that case investigation. So again, that means talking to the person or talking to their guardian about where they might have gone while infectious and who they might have come into close contact with. So if a school or early care program is one of those settings, then these settings are going to be advised on cleaning and disinfection of any areas where the person might have gone. So we're not recommending any kind of closing of settings, but you might need to block off an area until it can be cleaned and disinfected, right? So these settings might also be asked to help with contact tracing. So for example, if a person went to school while they were infectious and came into close contact with people, but they don't know the names of those people, then public health would be working with the setting to kind of figure out who those close contacts are. And again, you know, the recommendation for anyone who tests positive is that they stay in home isolation until they're no longer considered infectious. So we already kind of talked about what that means. Next slide. If there's a potential for exposure in a school or childcare setting, communication of fact-based information is really going to be key. And this is just a screenshot right out of the FAQ document that I've linked to, the CDC's FAQ document. So that's really going to include factual information that anyone who comes into close skin-to-skin contact with an infected person is really considered exposed. So it's not just, you know, everybody in a classroom or anything like that. So in the current outbreak, infections among children, even close household contacts have been really less common. So assuring parents and caregivers and staff that public health will investigate cases and close contacts are going to be identified, assuring the school and the child care setting, you know, that you guys are going to work with public health, that those settings are going to work with public health to help identify any specific close contacts if needed, that all close contacts are going to be notified by public health. They're going to be monitored by public health for symptoms for 21 days. Public health is also going to work with their healthcare provider to determine if vaccine or antiviral medication is indicated. So again, most people who have been exposed but don't have symptoms they're going to continue to attend school and childcare. Next, thank you. And finally, the guidance kind of covers some advice for parents who might have monkeypox. So ideally, a caregiver that doesn't have monkeypox will, you know, help care for the child. If that isn't possible, some advice to parents is, you know, cover the rash with clothes or bandages. They can wear masks, high quality, well-fitting masks for respiratory symptoms when they're interacting with the child, making sure to really clean and disinfect shared areas and items often. And then, you know, consider having their child vaccinated with JYNNEOS to lower the chances of developing infection or severe disease. Next slide. And these are just some resources. That should say FAQ, not FAZ. And then my email is at the bottom bullet. That's it for me.
Thank you, Farah. I don't want to tell you how many times I looked at that slide, and I probably should have caught that. But definitely want to open this up for questions. And really, I appreciate you not only making time to come and talk to us, but for providing great factual information. I know that after the last 2 years, it's really nice to just have some succinct information about what's happening and just be prepared. When I saw the resources come out from KDHE, I figured I probably should not try and talk about this myself. So very grateful to have an actual epidemiologist doing this for us. We appreciate you. Does anybody have any questions? And also all of these links we've pulled out, and so they've been placed in the chat as well if you want to check out those KDHE or CDC resources. But we definitely have time for questions.
It looks like Teresa wants to know if she can get a copy of the slide. Are we able to do that?
I'm fine with you sharing the slide deck. And actually, a lot of what I spoke about is in the notes section, so you can include the notes as well.
Yeah, and
That
Teresa,
would
if you
be
can
awesome.
just, can you drop your email in the chat and I'll just send it over to you when we get done today? Okay, well, again, Farah, we really appreciate it. Thank you so much for coming in, just kind of giving us an overview so that when this comes up in the settings that we interface with on a day-to-day basis, we've got some good information. So we very much appreciate it.
No problem. Have a good rest of your meeting.
All right, so unfortunately, like I said, we had a little hiccup with our schedule today, but really hoping to get the state interagency coordinating council and then the local interagency coordinating council, that agenda back on. I know it won't be next webinar because next webinar on September 7th is going to be KCSL talking to us about the Kansas Family Support Network. But we will bring that LICC/SICC presentation back around for all of you. As a reminder, the Early Childhood Recommendations Panel meeting is always on the third Friday of every month. So for September, that will be September 16th, 9 to 11:30. Any open forum comments, questions would need to be emailed to myself by the Thursday prior, 5 p.m. And we can share those during our live panel meeting, which is streamed on YouTube. We also have our Children's Cabinet and Trust Fund, and then the Early Childhood meeting in the afternoon. That'll be October 7th. You can register for both of those at the Kansas Children's Cabinet website. One last push before I leave you for the day. If there is something that you or your agency is working on that you're really proud of, that you want to come talk about, maybe a new initiative, maybe a pilot, maybe something that you're doing with PDG funds or as part of the strategic plan, we would love to hear about it. So it doesn't have to be a full presentation. It can be just a few minutes, but we just really like this space to be relevant and helpful for other people that might be going through some of the same challenges every day. And so I think that you all have just a wealth of information, and we'd love to be able to help you share that knowledge. So that's all we have for today. Again, we'll get that other agenda item back on the full schedule, but we will see you in 2 weeks for our next webinar. Thank you all.